Hey everyone, welcome back. Dr. J here, and today we're going to talk about a leg length discrepancy. So what you see in a lot of physical therapists and chiropractors is that when a patient is face down or even face up, what happens is that in order to test somebody who has low back pain or hip pain or even knee pain, you may see a doc kind of come back here and pull down on the ankles and say, oh, your right leg is off, or oh, your left leg is off, and then they'll bend the knees and they'll try to examine. But to be honest, research wise, this is a little subjective and it's not necessarily accurate. And so what we do is as chiropractors, we'll be like, oh, the doc you have to adjust this part of the pelvis, your right leg is short, so we'll adjust your hip. And there is some merit to that, but overall speaking, the general sense of leg length discrepancy, when somebody says, hey, you got a short right leg or a short left leg, that is pretty inaccurate. It is really rare for somebody to have what we call a congenital short leg, even though it is very, very possible. If somebody hasn't had a true measurement of the congenital short leg or doesn't have a history of fracture or some sort of hardware that's been put in place, it is really likely that they don't have a structural short leg. So that's where we get between structural and functional. Now, a structural short leg is what I just mentioned before, where the true bone, where the femur or the tibia is actually shorter, or what we have is more likely is a functional short leg. Now, a functional short leg will make it appear as if one leg is longer than the other. And that has to do typically with imbalances within the hips, the pelvis, and the low back. Now, and you can do this by various examinations, and we won't get into the examination per se, but you can go kind of heel to butt, and you can just tell by testing right side, left side, palpating and seeing which area of the body is tight and not tight. Now in this particular patient, she's probably going to be fine because we just did some muscle work and some ART and some Graston and as well as adjustments. So she's going to end up turning out pretty good. But either way, the determination of a functional short leg is based off of the ability for the hips to be contracted. So what you're going to see in people with a functional short leg is you're going to have innominate or ilium or SI joint rotations right in this way. One will be normally rotated backwards a little bit, and that is again as an imbalance of the hip flexors contracting. You'll also see this in patients with low back pain, patients who have disc injuries and have acute myospasms or spasms within the back. So what you'll see is the contracture of the right side of the low back come up. And so if I were to give that example right here and I have a spasm in my right side of the low back, what it's going to do is it's going to pull this hip higher. So it'll make it appear like a short leg. So if this side is in spasm, and this is again exaggerated right now, so and then we kind of go like this, of course this right side is going to look shorter. We bring it down, this is going to look shorter. So what we need to first do before we do any examination of this is we need to really just lengthen that person out the best we can and determine if that truly is a functional short leg. Again, if somebody of a doc or a PT or anybody says, hey, you have a short leg, kind of take it with a grain of salt, because again, it's more than likely a functional short leg due to some structural due to some muscular imbalances that you're having. Now the question is, are these muscular imbalances being fixed with a single adjustment or mobilization? It can help, but probably not. So again, somebody who tells you have a short leg, I would definitely question their ability to diagnose or some sort of do some sort of corrective activity, because if they're just adjusting you, they're not doing the entire thing that you need in order to get that functional leg to be back to normal function or to lengthen out the musculoskeletal system. All right, hopefully that helps you and clears up some confusion with regard to functional short legs and structural short legs. Thanks for stopping by. I'll see you next time.